Picture this. You're sitting in your doctor's office. You're 65 years old, feeling pretty good for your age. Then your doctor starts ordering test after test. Mammograms, PSA screenings, colonoscopies. You trust your doctor, so you say yes to everything. But here's what they're not telling you. Some of these routine tests that doctors recommend, they could actually do more harm than good after age 60. In fact, leading medical organizations, including the American Medical Association, have warned that certain screenings become risky, unnecessary, and even dangerous as we age. Today, I'm going to reveal the 5 routine checkups that may be causing more problems than they're solving for seniors. And I'll explain exactly why you might want to have a serious conversation with your doctor before agreeing to them. Stay with me because what I'm about to share could literally save you from unnecessary treatments, anxiety, and medical complications. Hello and welcome back to the channel. If you're new here, I'm dedicated to bringing you honest, evidence-based health information specifically for people over 60. The kind of information your doctor might not have time to explain during your 15-minute appointment. Now, before we dive in, let me be crystal clear about something important. I am not telling you to avoid all medical care. Regular checkups and preventive care are absolutely essential as we age. What I am saying is that medicine is not one size fits all, especially when you're over 60. The same tests that save lives in younger people can sometimes cause harm in older adults. Why? Because our bodies change. Our life expectancy changes. Our risk-benefit calculations change. And unfortunately, many doctors still follow outdated guidelines that don't account for these differences. The medical community has actually started recognizing this problem. There's even a campaign called Choosing Wisely led by doctors themselves. It identifies tests and procedures that are overused and potentially harmful. So today, we're going to look at 5 routine checkups that you should seriously question after age 60. For each one, I'll explain why it might be risky, what the research says, and what you should discuss with your doctor instead. Let's get started. Routine checkpoint number 1, annual mammograms after age 75. Let's start with a screening that many women have been getting faithfully for decades, the mammogram. Now, I know this is controversial. We've all been taught that mammograms save lives, and for women in their 40s, 50s, and 60s, they absolutely can. But here's what changes after 75. The U.S. Preventive Services Task Force, which is the gold standard for screening recommendations, says there's insufficient evidence to recommend routine mammograms for women over 75. That's right, insufficient evidence. Why? Let me explain. First, breast cancer grows much more slowly in older women. A small tumor found on a mammogram in a 78-year-old woman might take 10 or 15 years to cause any symptoms. At that age, you're statistically more likely to pass away from heart disease or another cause long before that slow-growing cancer ever becomes a problem. Second, mammograms lead to something called overdiagnosis. This means finding cancers that would never have caused harm during your lifetime, but once they're found, you can't unknow it. You'll likely undergo surgery, radiation, maybe chemotherapy, treatments with real side effects, for a cancer that never would have hurt you. Studies show that for every 1,000 women in their 70s who get regular mammograms for 10 years, about 3 to 4 will avoid dying from breast cancer, but 100 to 200 will have a false alarm requiring additional tests and biopsies, and about 10 will be treated for cancers that never would have threaten their lives. Think about that. The anxiety of a false positive, the pain of unnecessary biopsies, the side effects of radiation and surgery. For many older women, these harms outweigh the benefits. Now, does this mean no woman over 75 should get a mammogram? Absolutely not. If you're in excellent health, have a family history of breast cancer, or have a life expectancy of more than 10 years, mammograms might still make sense for you. The key is having an honest conversation with your doctor about your individual situation, not just following a blanket recommendation. Routine checkpoint number 2, PSA screening for prostate cancer after 70. Gentlemen, this one's for you. The PSA test, short for prostate-specific antigen, has been one of the most debated medical screenings for the past 2 decades. Here's the problem. The PSA test is really good at finding prostate cancer, almost too good. Because most prostate cancers in older men grow extremely slowly and will never cause symptoms. Let me share a statistic that might surprise you. Studies of men who died from other causes, car accidents, heart attacks, show that by age 70, about 50% of men have some prostate cancer cells in their body. By age 80, it's closer to 70%. Yet most of these men never knew they had it, and it never caused them a single problem. The medical term for this is indolent cancer, cancer that just sits there doing nothing. But when a PSA test picks up these slow-growing cancers, it triggers a cascade of medical interventions. Biopsies, which can cause bleeding and infection, then often surgery or radiation, which can lead to incontinence and erectile dysfunction, side effects that dramatically impact quality of life. The U.S. Preventive Services Task Force recommends against routine PSA screening for men over 70. They found that the harms outweigh the benefits for most men in this age group. A major European study followed more than 160,000 men for over a decade. They found that you'd need to screen 1,410 men and treat 48 men to prevent just one death from prostate cancer over 13 years. Meanwhile, those 48 men treated would likely face serious complications affecting their daily lives. Now, just like with mammograms, there are exceptions. If you have a strong family history of aggressive prostate cancer, if you're African American, which carries higher risk, or if you're in exceptional health for your age, you might still benefit from screening. But for the average man over 70, the PSA test often leads to finding problems that would have been better left undiscovered. It's called the incidentaloma problem, finding things by accident that end up causing more worry and treatment than benefit. Talk to your doctor, ask the hard questions. What happens if we find something? What's my life expectancy? What are the risks of treatment versus just monitoring? Before we continue with the next 3 checkups, I want to pause for a moment. If you're over 60 or if you're caring for an elderly parent or loved one, this information could be genuinely life-changing. It could save someone you love from unnecessary anxiety, painful procedures, or treatments with serious side effects. If you're finding this valuable, please take a second to hit that subscribe button and turn on notifications. I release new senior health content every week, and I'd love to have you as part of our community. Also, drop a comment below telling me, have you ever felt pressured to get a test you weren't comfortable with? I read every comment, and your experiences help others in our community. Alright, let's continue with checkpoint number 3. Routine checkpoint number 3, colonoscopy after age 75. Here's another big one, the colonoscopy. For decades, this has been considered the gold standard for colon cancer screening, and it absolutely is, for the right age group. But after 75, the math starts to change significantly. Colon cancer typically takes 10 to 15 years to develop from a polyp into an invasive cancer. If you've been getting regular colonoscopies in your 50s and 60s and they've been clean, your risk of developing colon cancer after 75 is already very low. The American College of Physicians and the U.S. Preventive Services Task Force both say that routine screening should generally stop at age 75, especially if previous screenings have been normal. Why? Because colonoscopy isn't without risks, especially for older adults. The procedure requires sedation, which can be risky for seniors with heart or lung problems. There's bowel preparation, which can cause dangerous dehydration and electrolyte imbalances in older adults. And there's a small but real risk of complications like bleeding or perforation, a tear in the intestinal wall, which can require emergency surgery. For seniors over 75, especially those with other health conditions, these risks often outweigh the benefits. Let me share a real-world example. A 78-year-old woman, perfectly healthy, goes in for a routine colonoscopy. During the prep, she becomes severely dehydrated. Her potassium drops dangerously low, and she falls, breaking her hip. She ends up in the hospital for 2 weeks, loses significant mobility, and develops complications that affect her quality of life for years, all from a routine screening test. Now, is this common? No. But it happens more often than you'd think, and the older you are, the more vulnerable you become to these complications. The guidelines are clear. If you're over 75 and have been regularly screened with normal results, you can safely stop getting colonoscopies. If you're over 85, screening is not recommended at all, regardless of your health status. There are exceptions, of course. If you have a family history of colon cancer, inflammatory bowel disease, or previous polyps, your doctor might recommend continuing screening. But it should be a careful, individualized decision, not an automatic, you're due for your colonoscopy. And here's something many people don't know. There are less invasive alternatives. Stool-based tests like Cologuard can detect colon cancer without the risks of colonoscopy. They're not perfect, but for seniors over 75, they might be a smarter choice. Routine checkpoint number 4, bone density screening after age 75 in men. This one specifically applies to men, though it's worth understanding even if you're a woman. Osteoporosis screening, usually done with a DEXA scan, is absolutely important for older women. After menopause, women lose bone density rapidly, and fractures are a major health risk. But for men, the picture is very different. Most men maintain stronger bones well into their 70s and beyond, unless they have specific risk factors. Yet many doctors automatically order bone density tests for all seniors, male and female alike. The problem is that widespread screening in older men leads to overdiagnosis and overtreatment. Men get labeled with osteopenia or osteoporosis based on test results, then get prescribed medications like bisphosphonates that have real side effects, including, ironically, unusual fractures of the thigh bone with long-term use. The U.S. Preventive Services Task Force says there's insufficient evidence to recommend routine bone density screening in men at all, at any age, unless they have specific risk factors. What are those risk factors? Things like long-term steroid use, previous fractures from minor falls, very low body weight, chronic conditions like rheumatoid arthritis, history of heavy alcohol use. If you don't have these risk factors, you probably don't need routine bone density screening, even after 75. Instead, focus on what actually prevents fractures: regular weight-bearing exercise, adequate calcium and vitamin D, fall prevention at home, and reviewing medications that might increase fall risk. Here's the bottom line: a DEXA scan number won't prevent a fracture. Strength training and not falling will. If your doctor orders a bone density test, ask them, why do you think I need this? What specific risk factors do I have? What would we do differently based on the results? These questions help ensure you're getting care tailored to you, not just following a checklist. Routine checkpoint number 5, annual EKGs and stress tests in symptom-free seniors. Our final checkpoint is one that might surprise you: routine heart screening in people who feel perfectly fine. Now, before you panic, let me be clear. If you have chest pain, shortness of breath, irregular heartbeat, or other cardiac symptoms, testing is absolutely crucial. And if you have known heart disease, your cardiologist might recommend regular monitoring. But what I'm talking about is routine EKGs and stress tests in seniors who feel fine, have no symptoms, and no history of heart disease. This is surprisingly common. Many doctors order these just to be safe during annual physicals. Here's the problem: these tests can pick up minor abnormalities that may be completely harmless, but look concerning on paper. This leads to more testing, often cardiac catheterization, which is invasive and carries risks, and sometimes to unnecessary treatments. The American College of Cardiology and the Choosing Wisely campaign specifically recommend against routine cardiac screening in people without symptoms. Why? Because false positives are extremely common, especially in older adults. Your heart naturally changes with age. You might have minor rhythm irregularities or EKG changes that are completely normal for someone your age, but get flagged as abnormal because they're compared to young adult standards. One study found that routine stress tests in people without symptoms led to more procedures, but didn't prevent heart attacks or improve survival. In fact, some people ended up with complications from the follow-up procedures that wouldn't have been necessary if they'd never been screened in the first place. This doesn't mean ignoring your heart health. It means focusing on what actually works: controlling blood pressure and cholesterol, not smoking, staying physically active, managing diabetes if you have it, knowing the warning signs of a heart attack, having a relationship with a doctor who knows your history. These proven strategies prevent far more heart attacks than any screening test ever could in a symptom-free person. If your doctor wants to order a routine EKG or stress test and you feel fine, ask them, what symptoms or risk factors make you think I need this? What would we do differently based on the results? Could we focus on prevention instead? You might be surprised how often the answer is, you know what, you're right, you probably don't need this. Now, I want to take a moment to address something really important, because I know some of you might be feeling worried or confused. I am not saying that all medical screening is bad. I am not saying you should avoid your doctor. And I am absolutely not saying that if you've been getting these tests, you've made a mistake. What I am saying is this: medicine should be personalized, especially as we age. The same screening that's life-saving at 55 might be harmful at 85. The same test that's crucial for someone with a family history might be unnecessary for someone without one. And the same procedure that's low risk for a healthy 60-year-old might be dangerous for a frail 80-year-old with multiple health conditions. This is why we need to think critically about the care we receive and ask good questions, not to second-guess our doctors out of paranoia, but to work with them as partners in our own healthcare. Good doctors welcome these conversations. They want you to understand why they're recommending something. They appreciate when patients are informed and engaged. If your doctor gets defensive or dismissive when you ask questions about whether a test is really necessary, that might be a sign you need a different doctor, one who respects you as a partner in your care. Remember, you have the right to refuse any test or treatment. You have the right to ask for a second opinion. You have the right to say, "Let me think about this and get back to you." Your body, your choice, always. So if you're not getting all these routine screenings, what should you be doing for your health after 60? Here's what actually makes the biggest difference in healthy aging. First, focus on the basics. Stay physically active. Even just 30 minutes of walking most days dramatically reduces your risk of heart disease, diabetes, falls, and cognitive decline. Eat a diet rich in vegetables, fruits, whole grains, and lean protein. Stay socially connected. Loneliness is as dangerous as smoking for older adults. Second, manage your chronic conditions. If you have high blood pressure, diabetes, or high cholesterol, work with your doctor to keep them under control. These are proven to prevent heart attacks, strokes, and other serious problems. Third, focus on functional health. Can you get up from a chair without using your hands? Can you stand on one foot for 10 seconds? Can you hear and see well? These practical measures of function predict your health and longevity better than most screening tests. Fourth, practice preventative care that works. Get your flu shot and pneumonia vaccine. Keep up with your medications. Review all your prescriptions regularly to make sure you're not taking anything unnecessary. See your dentist. Take care of your feet. Fifth, have a relationship with a good primary care doctor who knows you as a person, not just a set of test results. Someone who will take time to discuss your individual needs and risks, not just follow a one-size-fits-all protocol. And finally, educate yourself. You're watching this video, which means you're already doing that. Keep learning, ask questions, be your own health advocate. These strategies, the unsexy everyday habits, prevent far more disease and disability than any screening test ever could. Let's quickly recap the 5 routine checkups you should seriously question after age 60. Number 1. Annual mammograms after age 75, unless you have specific risk factors or excellent health. Number 2. PSA screening for prostate cancer after age 70. The harms often outweigh the benefits. Number 3. Colonoscopy after age 75 if you've had normal previous screenings. Consider stopping or switching to less invasive alternatives. Number 4. Routine bone density screening in men without risk factors. Focus on fall prevention and strength instead. And number 5. Annual EKGs and stress tests in symptom-free seniors. Screening without symptoms rarely helps and often leads to unnecessary procedures. Remember, the goal isn't to avoid all medical care. It's to make sure the care you receive actually helps you live better and longer, without causing unnecessary harm. Aging doesn't mean accepting every test and treatment thrown at you. It means being thoughtful, asking questions, and making informed choices that align with your goals and values. You deserve healthcare that respects your autonomy, considers your individual circumstances, and focuses on quality of life, not just quantity of tasks. If this video opened your eyes to a different way of thinking about medical screening after 60, please do me a favor, hit that like button and subscribe to the channel. We're building a community of informed, empowered seniors who take charge of their health. Share this video with your friends, your siblings, your adult children, anyone who might benefit from this information. These conversations can literally change lives. And please, drop a comment below. Tell me, which of these screenings were you most surprised to learn about? Have you had experiences, good or bad, with any of these tests? Your stories help others in our community make better decisions. Thank you so much for watching. Take care of yourself, ask good questions, and remember, you're not just a patient, you're a partner in your own healthcare. I'll see you in the next video. Stay healthy, stay informed, and stay empowered.